Hello everyone, I am Sanjay Ivanolo from BSN 111A, and today, during demonstration, I am going to perform the assessing of the abdomen. So assessment of the abdomen consists of inspection, auscultation, percussion, and palpation. This physical examination of abdomen is a key step in evaluation of abdominal complaints such as pain, distension, large organs, and muscles. So prior to the conduct of procedure, first thing to do is to review the client's medical records if available. Next is to prepare the necessary equipment needed in order to conserve energy and time. So the equipment that I am going to use in this procedure are the tape measure, a sharp object such as the ruler to test for the hypersensitivity test, and of course the stethoscope to hear for the bowel sounds, and of course provide patient's privacy such as clothing dispersing, and provide adequate lighting for the patient's comfort. And also, do not forget to perform hand hygiene before starting the procedure so that we can prevent cross-contamination between the patient and myself. Good afternoon, ma'am. I am Sanjay Ivanolo, your student nurse for today. Can you state your complete name? Francis Dayan Alone. Okay, your birthday and civil status, please. January 2004, single. Okay, thank you very much, ma'am. But before we proceed, may I ask what should I call you? Dayan. Okay, ma'am Dayan, today I'm going to assess your abdomen, which means I'll be exposing your abdomen as well as listening for your bowel sounds, and of course, to feel for your internal organs. Is that alright with you? Yes, ma'am. Okay, but before that, I'm going to ask some several questions. Is that alright with you? Alright, ma'am. Okay, so let's start. Do you feel abdominal pain right now? No. Are you comfortable with your position? Yes, I'm comfortable. Have you experienced abdominal pain in the past? I can remember. Okay. How about constipation? No. Diarrhea? No. Okay. So have you experienced change of appetite in the past years or past few weeks? No. Okay. Okay, so that's all. Would you like to void first? So that will be comfortable along the procedure. I already voided them. Okay, so make sure the patient have empty his or her stomach or bladder prior to the conduct of the procedure. For a full bladder can make the examination uncomfortable to the patient, and it can reduce the accuracy of the bundle height measurement. So now, position the client into a supine position with arms folded over the chest or just by lying on the side, and place a pillow underneath the patient's ribs. It will ensure abdominal relaxation in order to avoid putting additional pressure of the patient's abdomen. Okay, and then could you raise your knee for me, please? Now, cover the patient's upper and lower body parts, leaving only the abdomen exposed from the sigmoid process down to the just above the septum cubic. Okay, ma'am Dayan, I'm gonna roll down this blanket and raise your shirt. Okay, ma'am Dayan, may I ask, do you feel pain in your abdomen right now? No. Okay. So, ma'am Dayan, I will now begin with inspecting your abdomen first in order for me to check for your abdominal characteristics. Do not forget to note for any vascularities, stray, and different types of lesions, such as spots or rashes, then note for the history, so that it can be documented by institution, by quadrant, or reference lines. Okay? Also, for the inspection of the umbilicus, check for the color if there's sign of discoloration. Okay, so the umbilical skin tone is similar to the color of its surrounding skin, or even slightly pinkish. It should be recessed or inverted or protruding no more than 0.5 centimeter, and it should be round and concave. Now also observe for the presence of masses or bulges, such as an umbilical hernia, which means it's a protrusion of intestine or other tissue through a weakness or gap in the abdominal wall. Now to observe for the abdominal current symmetry, where the patient lies in a supine position and sit beside the client. Then look across the abdomen at a level slightly higher from the patient's abdomen. Then stand at the foot at the bed and again observe for the abdominal symmetry to check if it's round, flat, or distended. Okay, so the abdomen is normally flat, rounded, or scaphoid, in which is seen in adults, and it should be evenly round and symmetrical. So inspect the area between the lower ribs and pubic bones to observe for any abdominal enlargement. Okay, ma'am Dayan, I need you to stand up so that I can properly measure your abdominal girth. Is that alright with you? Yes, ma'am. Okay. Stand up now, please. Okay. So remember or measure the patient's abdominal girth by placing a measuring tape around the patient's abdomen at the level in the umbilical. Remember that the abdominal girth, it should be measured at the same time, ideally in the morning. Then, of course, make sure that the patient empties his or her bladder. Could you hold it for me, please? Then refer the distance and the designated units from centimeters to inches, for it's better to take a full measurement from the same location, especially if you notice any dissension. Inches. Okay. Okay, thank you, Ma'am Diane. You can now lay down back in the bed. Okay, Ma'am Diane, and we want to proceed to lifting your abdomen, and I just want to ask, when did you last eat? This morning. Now, frequent things may increase the peristaltic activity, so we're going to use one hand to and a diagram of the stethoscope to avoid circulation of the coldness of the stethoscope. So we'll start the auscultation from the right lower quadrant, then clockwise, and listen for each quadrant for at least 1 minute. So don't forget to note for the intensity, pitch, and frequency. So let's begin. Okay, Ma'am Diane, I'm going to place the stethoscope. Now to listen for the vascular sound, use the bell of the stethoscope and listen for bruised sounds over the abdominal, aortic soft, renal, iliac, and femoral arteries. To auscultate for the venous tone, use the bell of the stethoscope over the epigastric and umbilical area. Now listen to the peritoneal rub. We'll be using the diaphragm of the stethoscope to listen for the friction rub over the spleen and liver. Proceeding now with the percussion of the patient's abdomen, percuss several areas in each of 4 quadrants to determine the presence of the tympany and dumbness. Tympany is considered as the high-pitched sound, which indicates a hollow space filled by air, and dumbness suggested to breathe. Okay, Ma'am Diane, I'm going to percuss your abdomen. Okay? Now percuss for the vertical lever stand at the mid-clavicular line, then upwards towards the lever, and note for the timpani, and then if donut is heard, mark for it. Now percuss in the right mid-clavicular line on the area of long resonance around the third intercostal space, and percuss downwards to the lever, and note for the change long resonance, and mark this point. Now for a vertical lever stand in the mid-sternal line starting just above the umbilicus, percuss upwards towards the lever, and note for the change of timpani, and mark this point. Now for the upper borders, start percussion at the body of the sternum along with the third intercostal space, and percuss downwards until the tone changes flat to lever tones. Now measure the distance between two points. A normal lever span at the mid-clavicular line is about 6 to 12 cm, and the normal lever span along the mid-sternal line is about 4 to 8 cm. So now to assess the descent of lever, ask the patient to take a deep breath and hold it while percussing the right lower quadrant towards the lever, and no changes from timpani to dullness, and mark this point. Measure the distance between the lower border and the right coastal margin along with the mid-clavicular line. So to assess for the spleen and evaluate spleen megalomany, reposition into a right-sided lying position with left knee flexed, and identify the left anterior axillary line.
To assess for the spleen and evaluate spleen meganomaly, reposition the patient into a right side lying position with left knee flexed, and identify the left anterior axillary line. To assess the site of the spleen, percuss the left anterior chest wall roughly from the border of the cardiac dullness at the 6th rib to the anterior axillary line and down to the costal margin. Percuss the lowest interspace in the left anterior axillary line, and ask the client to take a deep breath and percuss again. Okay, ma'am. Again, I need you to take a deep breath. Okay, thank you.
Perform the lever blood percussion to assess lever tenderness. Place the left hand against the lower anterior rib cage, and then use the ulnar surface of your left hand to strike the right hand. Okay, ma'am, do you feel pain? No. Do you feel pain? No. Do you feel pain? No. Okay. So perform the kidney punch to assess the kidney tenderness, then reposition the patient into a kidney position. Okay, ma'am Dayan? Did you see it all? And adjust your loading. Okay, thank you. And then place the left hand at the costal vertical angle over the 12 ribs, and use ulnar side of the right feet to strike the left hand, and ask the patient for anything. Okay, do you feel pain? No. 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 Okay, thank you very much, ma'am. You can now lie down again. So test for the size, test for the shifting loudness while the patient lying supine on the bed. Then percuss the flanks of the patient from bed towards the umbilicus, noticing for the changes from the dullness to timpani and mark it. Okay, let's make sure. Then reposition the patient into a supine position and percuss the abdomen from the bed upwards, and noticing for the changes from the timpani dullness into a position towards the camera. Okay? Sideline position, please, ma'am. Adjust your little bit, please. You can now lie down again. For fluid-based test, when the client is lying in supine position, ask the client to press the edges of her hand firmly down in the midline of her abdomen. Then tap one flank sharply with fingers to feel for a fluid wave transmitted across the abdomen to the opposite mark. Okay, Ma'am Dayan, I need you to do this. Okay. Then perform the flank. Ma'am Dayan, do you feel pain? No. What this? No. Yes, please. Again? No. No. Okay, thank you very much, ma'am. Perform light palpation to assess for tenderness and for presence of mass. When the client or the patient lying relaxed and occupied position, begin with a light systematic palpation of all four quadrants or the 9 regions, using the finger pads in order to initially avoid the areas that the patient has indicated as painful. And of course, do not forget to observe for reports of pain, tenderness, and muscle. Now perform the palpation, which is done to feel for the internal organs and muscles. Then compress the abdomen to a maximum of 5 cm using the palmar surface of the hand, initially avoiding again the painful areas and palpate with muscle resistance or muscle. So to perform moderate palpation with the umbilical ring, looking for any presence of the masses, swelling, nodules, granulation to assess for tenderness and presence of mass. So in the palpation of the abdominal area, abdominal aorta, use both hands to deeply palpate the epigastrium, slightly to the left midline. Now palpate for the liver to assess for the liver contour, surface, presence of nodules, tenderness, and irregularities. Then place the left hand under the client's back at the level of 11 to 12 grades, while the right hand is laid parallel to the right coastal margin with fingertips pointing towards the client's head. Then, of course, instruct the client to take a deep breath and then compress the fingertips upward towards the lower border of the liver to assess for contour, surface, nodules, tenderness, muscles, and irregularities. Okay, Ma'am Dayan, I need you to take a deep breath. Okay, inhale. Inhale. Exhale. Again, please. Exhale. Inhale. Exhale. Okay, thank you very much, ma'am. Now perform the hooking technique by standing at the client's right side, facing her feet, then press in upward the coastal margin with your fingertips and ask the patient to take a deep breath gently and firmly pull inward and upward with the fingers. Then palpate for the liver edge as it descends to meet the fingers, noting for the contour, surface, noodles, tenderness, and irregularities. Okay, Ma'am Dayan, I need you to take a deep breath, please. Okay. Again. Okay. One last time, please. Okay, thank you very much. So the test for the cholecystitis, press fingertips under the liver border at the right coastal margin, and note for the right upward organ, pain, and tenderness. Okay, Ma'am Dayan, I need you to take a deep breath, please. Okay, exhale. Again. Okay, thank you very much, ma'am. So percuss the spleen and assess for splenomegaly and stand at the patient's right side and reach over the patient's abdomen. Then place your left hand posterior to the lower rib gently and place your right hand below the left coastal margin, then press in towards the spleen. Okay, Ma'am Dayan, I need you to take a deep breath, please. Okay. So in palpating, try to feel the ends of the spleen as it comes down towards the fingertips. Then note for the tenderness and assess for the spleen contour. Okay, Ma'am Dayan, take a deep breath again, please. Okay, again. Okay, thank you very much, ma'am. So repeat the procedure with the client lying on the right side or towards me with somewhat legs flexed up to the hips and knees if needed. Okay, Ma'am Dayan, I need you to turn towards this side and take a deep breath. Okay. Okay. Again. One last time. Okay, thank you very much. You can now lie down. So to palpate for the kidney, assess for kidney enlargement and stand at the right side of the patient, then place the left hand under the patient's right posterior flank and place your right hand at the right coastal margin at the mid-clavicular line. Okay, Ma'am Dayan, I need you to take a deep breath and hold it in so that I can feel for your right kidney just beneath with my finger. Is that all right with you? Yes, sir. Okay. Take a deep breath. Okay. Again. So one more time, please. Okay, thank you very much. Then repeat the procedure in the left kidney. Okay, deep breath. Again. Okay, one more time. Okay. So in performing the hypersensitivity test, we'll use the urine test by placing my hand in the osteoid tip pubis, then move the fingers upward and outward in order to estimate for the bladder. Then after that, we'll use a sharp object to test for the hypersensitivity test of the abdomen and note for the patient's reach. Okay, Ma'am Dayan? I'm gonna trace this ruler on your abdomen and tell me if you feel pain, okay? Okay. Do you feel pain? No. How about this? No. This? No. Okay, thank you very much, ma'am. So to test for psoriasis sign, position the client to the left side and hyperextend the right leg and note for the reaction of the patient. Okay, Ma'am Dayan, and you turn to your left side. Do you feel pain? No. How about this? No. Okay. Then I'll turn back. Then proceed to the obturator sign by flexing the patient's right knee and ankle, then note for the patient's reaction. Do you feel pain? No. Okay, one more time. Do you feel pain? No. Okay. So to test for the appendicitis, assess for the patient's rebound tenderness by palpating deeply at the 90 degrees into the abdomen, then suddenly release the pressure to observe for the patient's expression of pain. Okay. Do you feel pain? No. How about this? No. This? No. One more time? No. Okay, thank you very much, ma'am. Did you feel pain perhaps when I release the pressure in your abdomen? No. Okay, thank you very much, ma'am. Okay, Ma'am Dayan, so since we're done with our assessment of your abdomen, I am going to summarize all the information that I have obtained during the working phase and discuss the findings to you, so in order for you to resolve any possible health problems. So upon this inspection, your skin color is uniform, no signs of lesions, scars, and rashes, then your umbilical or your belly button is round and not protruding, which means it's within the normal range, and your abdomen is symmetrical. Then upon auscultation of hearing for your bowel sounds, they are pretty normal, which I don't hear bruise. And in terms of measuring your liver size, in the right mid-clavicular line, it is measured as 8.5 cm, and with the mid-sternal line, it is measured as 5 cm, which indicates it's within normal range. Lastly, upon for palpation for your liver, spleen, and abdomen, I don't notice any masses, tenderness, no bulge, no swelling. So overall, the assessment was good. So do you have any clarifications with the result, Ma'am Dayan? No. Okay, so as I said earlier that your abdomen assessment resulted as good, so I will take this opportunity to tell you that keep your abdominal organs healthy by taking or eating healthy foods and increase your fluid intake so that you can wash off the unnecessary residue, as well as having the right proper circulation or cycle of urination, and as much as possible, avoid drinking alcohol. Okay? Yes, ma'am. So perhaps do you have any questions before we end? None, ma'am. Okay, so since it's none, we're done, and I'll leave you so that you can have your test. Thank you very much for your cooperation and have a nice day ahead. Thank you, ma'am.